Let's talk about that. In 2003, the federal government did the second survey of adult literacy in the United States. The National Assessment of Adult Literacy released the data in December of 2005. About 17,000 people participated in the survey, folks who were over the age of 15 living in households and prisons. The reason they looked at the prison population is we know literacy levels are lower in people who are in prison. They divided people up into 4 functional categories of literacy, what they could do with written information, below basic, basic, intermediate, and proficient levels. People at the below basic can deal with a single piece of information. So they can sign their name on a document, identify a country in a short article, or total a bank deposit slip. But they'll have difficulty entering information on a Social Security card application, locating an intersection on a street map, or calculating the total cost on an order form. People at the basic level can deal with 2 related pieces of information. So they could identify year-to-date gross pay on a paycheck, or determine the price difference between tickets for 2 shows. But they'll have difficulty using a bus schedule, balancing their checkbook, or writing a short letter explaining an error on a credit card bill. Depending on which kind of literacy you look at, prose, document, or quantitative, and you put together basic and below basic literacy skills, somewhere between 34 and 55% of American adults are at the basic and below basic level of literacy. 34 to 55%. How come we don't hear about this? Why isn't anybody talking about this? Because it's an embarrassment. It's a commentary on our educational system. The other thing they did during the NAL assessment is they asked some specific health-related questions. So they actually assessed health literacy, ability to read information and understand it. 28 questions specifically related to health, 3 clinical, 14 prevention, 11 about system navigation, how to deal with insurance and that sort of thing. And then they just analyzed that subgroup, that smaller group of questions. And these numbers I'm going to show you going forward are just about the health literacy questions. So if you look at the entire population of the United States, a grand total of 12% of the adults are considered proficient at health literacy. 12%. Intermediate, 53%, basic, 22%, and below basic, 14%. And by the way, let me comment, even though these numbers are from 2003, the previous one was done about 10 years before. The numbers really didn't change in that 10 years. And we're anticipating that another survey will be done in another few years. So the data's old. I have no expectation that things have changed. In fact, high school graduation rates have gone down and reading levels have gone down in the United States. So it's not going to get any better, folks. If you look at it based on ethnicity, and you put together the basic and below basic health literacy folks, the entire population is 36% in basic and below basic. But if you look at it by ethnicity, no surprises here. Whites, 28%, Native Americans, 48%, blacks, 58%, Hispanics, 66% at basic and below basic health literacy. If you look at it by age, I lumped everybody together between age 16 and 64, and basic and below basic health literacy, 28 to 34%, only 28 to 34%. But our Medicare population, people age 65 and older, 59% at basic and below basic health literacy. If you look at it by education level, high school, if someone's in high school, they have a GED, a graduate education degree, or a high school equivalency, or they're a high school graduate, 34 to 37% of those at basic and below basic health literacy. But if you're an adult and you're not in school and you don't have a high school diploma, 76% of those folks are at basic and below basic health literacy. In Wisconsin, that's 760,000 people in our state alone. 760,000 people. And then if you look at it, they had people rate their health status. Self-rate, how am I feeling? What would I consider my health? And as you look at these numbers, and you look at the numbers going forward that I'm going to tell you about, this is called an association. There's a very clear association between health literacy and self-rated health status, but we really don't understand cause and effect. But there's a very clear gradation. People at excellent, only 25%. Basic and below basic health literacy, all the way down to poor, we're 69% at basic and below basic health literacy.